Depression is a widely recognized mental health condition, but did you know that the term depression can refer to multiple different diagnoses? There are various types of depression, each affecting people in different ways, leading to multiple classifications. Let's explore the 10 most common types of depression. The first type is Major Depressive Disorder, otherwise known as clinical depression. According to APA, Major Depressive Disorder is a depressive disorder characterized by persistent low moods, loss of interest in your favorite activities, and a lack of motivation to carry out basic tasks. MDD is the most common form of depression, and when someone says that they've been diagnosed with depression, they're likely referring to this condition. Symptoms of MDD include low energy, feelings of being a burden on others or having low self-worth, difficulty concentrating and making decisions, sleeping too much or too little, loss of interest or pleasure in activities, recurring thoughts of death or suicide, and significant weight loss or gain. Symptoms of MDD must be present for at least 2 weeks in order to be diagnosed. The second type of depression is Persistent Depressive Disorder or Dysthymia, a depressive disorder similar to MDD, except that it is long-lasting. Symptoms of PDD are similar to those of major depression, but often fewer and not as intense. These symptoms must occur for at least 2 years to be diagnosed. The third type of depression is bipolar disorder, which is a group of mood disorders in which symptoms of mania and depression alternate. During depressive periods or the lows, a person with bipolar disorder may have depressed moods, lack of energy, not enjoying things they once liked, trouble concentrating, inability to feel pleasure, trouble making decisions, needing more sleep or an inability to sleep, appetite changes that make you lose or gain weight, and thoughts of death or suicide. The dramatic periods of high and low moods in bipolar disorder are often unpredictable and can sometimes occur at the same time in mixed episodes. These episodes may occur over weeks, months, or even years. The fourth type of depression is Seasonal Affective Disorder, or SAD. SAD is a disorder in which there is a predictable occurrence of major depressive episodes, manic episodes, or both at particular times of the year. The typical pattern is the occurrence of major depressive episodes during the fall or winter months, but in some cases, it can occur in spring and summer. People with SAD typically sleep much more than usual and crave carbohydrates. They also have many of the normal warning signs of depression, including feeling sad, cranky, or hopeless, less energy, trouble concentrating, greater appetite, increased isolation, and thoughts of suicide. The fifth type of depression is Postpartum Depression, which is a depressive episode that affects some women within 4 weeks to 6 months after childbirth. Postpartum depression signs and symptoms may include depressed mood or severe mood swings, difficulty bonding with your baby, withdrawing from family and friends, loss of appetite or eating much more than usual, inability to sleep or insomnia or sleeping too much, fear that you're not a good mother, feelings of worthlessness, shame, guilt, or inadequacy, severe anxiety and panic attacks, thoughts of harming yourself or your baby, and recurring thoughts of death or suicide. The sixth type of depression is Premenstrual Dysphoric Disorder, or PMDD, which is a condition that affects some women during the week before menstruation and typically goes away within a few days of starting. The symptoms must be severe enough to affect social, occupational, or other important areas of functioning. Symptoms of PMDD include feelings of sadness or hopelessness, irritability or anger that affects other people, mood swings, anxiety, decreased interest in daily activities and relationships, trouble concentrating, fatigue, changes in appetite or sleep, feeling overwhelmed or out of control, and physical symptoms like breast tenderness, joint or muscle pain, and bloating. The seventh type of depression is Atypical Depression, which is a type of major depressive episode that has features that are unusual compared to other types of depression. People with atypical depression may have mood reactivity, which means they can experience an improvement in mood when something positive happens. Other symptoms may include feeling emotionally paralyzed, significant weight gain, increased appetite, excessive sleepiness or trouble sleeping, and feeling very sensitive to rejection or criticism. The eighth type of depression is Psychotic Depression, which is a type of major depressive episode that also includes psychotic symptoms, such as delusions or hallucinations. These symptoms often involve themes of guilt, personal inadequacy, or illness. People with psychotic depression may also experience psychomotor agitation or retardation, which means they may move or speak slowly, or experience physical restlessness or agitation. The 9th type of depression is situational depression, also known as adjustment disorder with depressed mood, which is a type of depression that occurs in response to a stressful life event, such as a job loss, divorce, or the death of a loved one. Symptoms may include feelings of sadness, hopelessness, or worthlessness, changes in appetite or sleep, difficulty concentrating, feelings of isolation, and a lack of interest in activities that were once enjoyable. And the 10th type of depression is substance-induced depression, which is a type of depression that is caused by substance abuse or withdrawal from drugs or alcohol. Symptoms may include feelings of sadness or hopelessness, changes in appetite or sleep, fatigue, difficulty concentrating, and thoughts of suicide or death. Treatment may involve substance abuse treatment as well as therapy or medication for depression. We hope you found the video informative. It's important to recognize that different types of depression can be very challenging to deal with. If you're experiencing difficulties, please don't hesitate to seek help from a qualified mental health professional. They can guide you towards a better path and get your life back on track. If you found this video helpful, please consider liking and sharing it with others who may benefit. We appreciate you tuning in and take care.